Have you ever experienced unidentified fatigue or noticed changes in your body that left you confused? In this video, we're going to tell you the silent indicators that may point to underlying heart disease. So let's dive in. Number 1. Fatigue and weakness. Fatigue and weakness is more than just feeling tired after a busy day. It's a constant fatigue that doesn't go away with sleep. This subtle sign could be your body's way of signaling cardiovascular issues. Fatigue can occur when your heart is unable to pump blood efficiently, which leaves your body without enough oxygen. Feeling tired and weak can happen to anyone, especially with a busy schedule or not enough sleep. But what if that tired feeling sticks around, even after a good night's rest? That might be a signal from your body that something more serious is going on. It could be linked to your heart health, like issues with your arteries or even heart failure. So, if you're finding it hard to shake off that tiredness, it's a good idea to reach out for some help. Your body might be trying to tell you something important about your heart. Number 2. Shortness of breath. Shortness of breath can be a common occurrence after intense physical activity. But what happens if it occurs for no apparent reason? This section goes into the nuances of breathing difficulties as a quiet sign of heart issues, providing insight into situations in which it isn't just a typical response to physical activity. Even though experiencing shortness of breath is a normal reaction to physical exertion, it should be taken seriously if it continues for no apparent reason. Heart failure or problems with the heart valves can impair your heart's ability to pump blood efficiently, which can result in a lack of oxygen reaching your blood and subsequent dyspnea. If you find yourself struggling to breathe during routine activities or while at rest, it's time to investigate further. Shortness of breath accompanied by chest pain, fatigue, or lightheadedness should not be dismissed as normal. Number 3. Irregular heartbeat. Your heart beats to its own rhythm, a steady and reliable drum keeping you alive. What happens, though, if the beat becomes erratic and the dance appears out of time? An irregular heartbeat may not always be obvious. Sometimes your body will whisper to you to tell you to pay attention. Understanding irregular heartbeats begins with recognizing what's normal. A healthy heart beats in a regular, coordinated pattern, ensuring blood is pumped efficiently throughout your body. Age, stress, and lifestyle decisions, among other things, can cause abnormalities. It's critical to pay attention to any changes in your body's unique rhythm and to listen to it. Being sensitive to small alterations is necessary to identify irregular heartbeats. A short pause, an extra beat, or a fluttering sensation in your chest could be felt. These anomalies can occasionally be so transient that nobody notices them. On the other hand, persistent abnormalities should not be disregarded, as they may indicate a problem with the electrical system of your heart. Number 4. Chest discomfort. Your heart is your most important organ, and your chest is a stronghold that guards it. It's easy to write off chest pain as being caused by a straightforward case of heartburn, particularly after a large meal. But what if the tale is not over yet? What if your chest is attempting to communicate with you regarding the health of your heart? Heartburn, often characterized by a burning sensation in the chest, is a common culprit for discomfort. It happens when food gets trapped in the stomach tube, which transports food from your mouth to your stomach. But not every pain in the chest can be written off as heartburn, and it's important to know the difference. It may be more than just indigestion if chest pain lasts longer than the normal heartburn duration, or if it doesn't coincide with meals. Your heart can communicate through a variety of sensations, and discomfort in the chest may be a subliminal sign of heart problems. Number 5. Dizziness and fainting. Experiencing occasional dizziness may seem like a minor annoyance in the complex dance of life. Dizziness and fainting, however, may indicate signs of cardiovascular distress if they start to occur frequently in your daily life and are not just transient discomforts. Inadequate blood flow to the brain is a common cause of dizziness associated with cardiovascular disease. Feelings of lightheadedness or dizziness may arise if your heart is having trouble pumping blood efficiently, depriving your brain of the oxygen it requires. This unnerving feeling can be caused by conditions like low blood pressure, heart valve problems, or arrhythmias. Diagnosing dizziness and fainting requires an understanding of the patterns and triggers associated with these conditions. These episodes may be related to cardiovascular problems if they happen after abruptly standing up, during stressful situations, or after physical exertion. Healthcare providers may find useful information by documenting the times of these episodes and any associated symptoms. Number 6. Swelling in the legs and ankles. Your legs are dependable allies who help you get around life's journey. When they begin to swell, it's not only a matter of appearance. Your body may be trying to tell you something by giving away subtle signals about possible heart issues. Edema, or swelling in the legs and ankles, is a minor but important symptom that needs to be checked out. When too much fluid builds up in the tissues, it is called edema and causes swelling. Cardiovascular-related edema can have many causes, but it frequently indicates an imbalance in the body's fluid regulation system. Figuring out the subtle characteristics of this swelling is essential to finding hidden heart warning signs. Heart failure is one of the main cardiovascular conditions associated with swelling in the legs and ankles. Heart failure results in a backlog of fluid in the body because the heart's ability to pump blood is impaired. This fluid tends to pool in the lower extremities, where it causes noticeable swelling. Number 7. Persistent cough. A persistent cough can be more than just a nuisance or a sign of a common cold. More than just a bother or an indication of a common cold can be indicated by a persistent cough. Sometimes, it could be your body's way of telling you there's an unexpected relationship to cardiovascular health. Although we typically link coughs to breathing issues, investigating the potential cardiovascular connection helps clarify the complex relationships among various body systems. Heart failure is one serious cardiovascular condition linked to persistent coughing. The heart's capacity to pump blood efficiently is compromised by heart failure. This may result in a buildup of fluid in the lungs, irritating the respiratory system, and producing a chronic cough. It's essential to understand that this cough is a reflection of the heart's difficulties rather than an allergy or respiratory infection. Number 8. Changes in nail appearance. Although they are frequently thought of as simple accessories, your nails can be more than just a place to put polish on. They can also be subliminal signs of heart health. Your nails' changing appearance could reveal information about internal health issues, especially related to your circulatory system. Comprehending these subtleties adds another level of proactive health monitoring. Although the relationship between alterations in nail appearance and heart health may come as a surprise, it is based on the body's complex network of interrelated systems. The circulatory system provides nutrition and support for nails, just like it does for other structures. Nail changes can occur when the heart experiences difficulties. The altered blood and oxygen flow is the mechanism underlying nail clubbing. Insufficient oxygen-rich blood reaches the extremities in cardiovascular conditions such as chronic heart and lung diseases or congenital heart defects. This causes the body to adjust by enlarging the blood vessels in the fingertips, giving them their distinctive clubbed shape. Number 9. Sleep apnea. A threat that silently affects your cardiovascular health could be lurking in the quiet of the night as you drift into a state of dreams. Sleep apnea is more than just a disturbance in your sleep patterns. It can also pose a risk to your heart and general health. Unfortunately, it is frequently overlooked and goes undiagnosed. The most common sign of sleep apnea is irregular breathing pauses during the night. Apneas, the name for these disruptions, can last anywhere from a few seconds to several minutes and might happen in several times throughout the night. Even though the individual experiencing these disruptions might not be completely conscious of them, the effects they have go beyond just disrupted sleep. Number 10. Jaw pain. When we think of heart-related symptoms, chest pain often takes center stage. However, an unexpected player in the symphony of cardiovascular signals is jaw pain. Strange as it may sound, jaw pain or discomfort might be a mild but important marker of underlying heart issues. Comprehending this relationship is essential to identifying any cardiovascular issues. Many people are surprised to learn that heart problems can cause jaw pain. Similar to the chest, the jaw and the heart are near each other, and pain in this area may indicate heart problems. It's crucial to understand that not every jaw discomfort indicates a cardiac issue, but some symptoms do call for further investigation. Thanks for tuning in to explore the subtle signs of heart health with use. If you found this information helpful, hit the like button, share it with someone you care about, and subscribe for more insightful content. Take charge of your heart health, listen to your body's whispers, and remember, a healthier heart leads to a happier life. Stay heart conscious, and we'll see you in the next video.